According to a study conducted by Macquarie University School of Public Health in partnership with the Ministry of Health and Duke Global Neurosurgery and Neurology, the national prevalence rate of epilepsy in Uganda is alarmingly high at 1.69%, indicating that over 770,000 Ugandans are living with the condition. This highlights the urgent need for increased awareness, resources, and interventions. In an interview with Dr. Henry Sechanzi, a medical doctor, he provided further insights into this common condition, which has brought significant emotional, financial, and social challenges to many families. He began by explaining some of the causes of epilepsy.
Among the causes, and some of the times, these causes start when the babies are still in their mother's womb. For instance, if a mother sustains trauma as a result of gender-based violence, and maybe the baby inside there gets a problem with the brain, the moment they are born, actually they could get epilepsy later in life. Sometimes the problems happen during the time of child delivery. You all know that childbirth is difficult. Sometimes babies could sustain trauma that could actually affect their brains, and later on they end up with epilepsy. Sometimes they're genetic, whereby if somebody's parents or maybe the grandparents had it, sometimes the children or maybe the grandchildren could as well have it. In the adults, most of the times it's as a result of things which could cause trauma to the brain, things like traumatic brain injury, which could happen if maybe somebody has been hit on the head. These days there are so many thieves in Kampala who hit people with iron bars. Some of the times you could actually get these people into getting what you call epilepsy.
Despite the fact that the condition can be controlled if detected early, Dr. Henry explains that due to lack of public awareness, many individuals remain untreated.
Epilepsy can be controlled. Actually, if people have the diagnosis made on time and started on the treatment, the seizures can actually be controlled. Many times people may not get the appropriate medication, they don't even get the diagnosis, sometimes they don't even seek this medical attention. So because of that, there's a very big gap. Many people out there having these conditions and then they're not being treated simply because they don't know what to do.
He outlined some of the risks and challenges that patients with epilepsy face in their daily lives.
There are quite a number of risks which come with it, and as we saw, it's quite common in children. So these children in schools, they're going to be stigmatized. Children are going to name call them, they're going to isolate them, they will not want to play with them, and of course this affects their performance in school. Some of them don't live to fully have a complete school. Many of them don't even proceed up to senior secondary school level. So because of all these and the stigma that is attached, many of these actually don't get to live to their full potential. They will be disadvantaged in terms of economics. They will not be able to earn money, they're not be able to attain education, they're going to be segregated, they're usually not loved in their families, and this could even get them into depression. Because of depression, some of them could opt for bad coping mechanisms.
He reiterates some existing challenges in the healthcare system, citing the gap in treating epileptic patients, and emphasizes on the need of awareness to the general public.
Some of these facilities that we need to do most of this workup are missing. We don't have as many CT scans in this country. We don't have electroencephalograms that we need to investigate our patients very well, and that really is a very big challenge that needs to be addressed. At the level of the ministry, quite a lot has to be done in terms of the policy and guidelines on what has to be done. So we need to come up with policies to guide us on how to take care of these patients, not only in hospitals but even in schools, where these children are attending schools. The teachers need to be taught on how to take care of them. Families need to be taught, communities need to be taught on how to support these patients.
Dr. Henry Sechanzi also had this to say.
Even you patients, you have a role to play. You have to adhere to the medication. Many times you write for a medication, you get them, you take them for a few months, you start feeling okay, you become seizure-free, and you stop the medication. You forget that it's this medication that helped you improve. Okay, so the moment you've been prescribed the medication, you don't have to leave the medication until maybe your doctors tell you that maybe it's about time that you can leave.
Epilepsy is a neurological condition characterized by recurrent unprovoked seizures resulting from abnormal electrical activity in the brain. Hope Nyongereza, Church of Uganda Family TV, News at 8.